Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Senior Marketing Specialist Rachel Rahm. In today's special Nurses Month episode, we sit down with CompleteRx Systems Director of Pharmacy, Paul Green, to discuss the importance of a strong relationship between nursing and pharmacy. All right, so welcome, Paul, and thanks for joining us in today's National Nurses Month episode. I appreciate you joining us.
Thank you so much for having me.
Yeah. So, Paul, we're absolutely going to get into the things as they relate to the COVID-19 pandemic. But I first really would like to ask you about the relationship between nursing and pharmacy outside of a pandemic. What does that relationship typically look like, and what things do you find work to help maintain a collaborative relationship between those two groups?
Sure. A strong relationship between nursing and pharmacy is essential for quality patient care and satisfaction throughout the healthcare team. What I've found is that it really comes down to having an open dialogue and a forum where you can both bring your ideas and barriers and discuss them as a team. For example, we've implemented nurse to pharmacy communication forms to
Hmm.
maximize nursing's time and decrease the time that they'll need to call the pharmacy as long as something's non-urgent and whatever needs they have. We've also have a nurse and pharmacy committee that meets monthly to work towards continual improvement of the relationship and to address any trends and issues that may be arising.
Yeah. So, really open communication sounds like is key here. So now I want to shift a little and discuss, what the last 18 months has looked like. It goes without saying that the last year and a half has been unlike anything anyone could have anticipated. So how has the way we work with nursing changed? And would you say it's offered up new opportunities? I know recently there has been so much dependence on nursing and pharmacy to help navigate the vaccine rollouts, specifically.
Yeah, the vaccine process is a great example of nursing and pharmacy teaming up to take on a new challenge and meet it with success. At my hospitals, nursing and pharmacy have worked together to spearhead the vaccine clinics throughout our communities and also within our own hospitals.
Hmm.
It's mutually beneficial connection since there's several overlapping skill sets with regard to drawing up an administration of the vaccine, but there's also room for the expertise of each specialty to shine since the pharmacists can manage the storage and distribution of the vaccine and the nurses can then monitor the patients clinically after the administration.
Yeah. Wow. What a great way for, those two departments, ours included pharmacy to be able to kind of show our teamwork to everyone in the hospital setting. So what words of advice could you offer organizations that might struggle with the relationship between pharmacy and nursing?
I've found that a lot of times a lack of understanding of what each other are facing in real life on a daily basis may be leading in a large part to this struggle.
Hmm.
Taking time to develop relationships between the departments and even putting some time into shadowing in each other's worlds to get a
Hmm.
real true understanding of what they're facing on a day-to-day basis and potential pain points can really be helpful.
Yeah. So the old step into someone else's shoes for a little while.
Absolutely.
Awesome. Well, Paul, thank you so much for your time and for sharing in your experiences with us today. I know you and your team have witnessed firsthand just how incredible and pivotal nurses have been and continue to be throughout the entire pandemic. Do you have any last words you'd like to leave our audience with this Nurses Month?
The nurse pharmacist relationship is sometimes overlooked, but it can be one of the most important ones in hospital healthcare. And like any good relationship, it takes time and effort to develop and maintain, but it pays incredible dividends for both the employees and the patients.
Awesome. Well, thanks so much, Paul. We really appreciate everything and meeting with you today.
Absolutely. Thank you.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.